All right, thank you for staying with Citizen TV. The hashtag is Daybreak at Trevor Mbija at Citizen TV Kenya. We're talking about the state of the nation. Now we know that key government stakeholders snapped talks with doctors in a crucial meeting that sought to offer solution on the looming doctors' strike. Both the Ministry of Health, the Education Ministry, the Treasury and the governors were a no-show. Therefore, the doctors are saying from Monday, the strike is on. Dr. Mutu, I'll start with you. Being a governor, COG did not show up, and now the doctors are going on strike. Who should take responsibility for this?
I didn't get a chance to clarify my very good speaker of Nyeri when he tried to correct me that the election in the US is held in different days. Actually, the law in the US, and I lived in the US when they are through 2 election cycles, is that the election date is set for the first Tuesday of November. It is set by law. The mail-in ballots have to have come in. So the mail-in ballots is, we are talking about the election day. So Americans vote on one day, but the mail-in ballots are mailed in. So it's a different system, but election day is set. Now, about the doctors' strike, we as governors are very concerned. Today at 2 o'clock, we have a Council of Governors meeting to discuss the strike. We've had several meetings. It is an anomaly to say that the governors did not attend. The COG sent representatives. The governors were not invited as governors to go to that meeting. We sent our COG representatives in charge of HR, in charge of issues to deal with health, to that committee that the meeting was held yesterday. And we gave our presentation. So we were clearly represented. We got a team that went there. It doesn't have to be the governor himself who goes. We got a technical team that presented the technical issues very well yesterday because we take it very seriously. The issues that they are bringing up, the governors are in agreement with the issues of, for example, NHIF. We have said that we're going to have advanced NHIF. For those counties that don't have, Machakos we do, other counties do, so that all doctors are covered. We as governors have decided that every county will set up a hospital just to treat our health workers. And you have to remember, it's not just about doctors. Our health workers, more health workers, nurses, for example, are more affected by COVID than even just the medical doctors than others. So, because when a patient goes to a hospital, who do they see first? They go to register, they see the nurse, they go for triage, where the nurse is touching them, measuring their temperature, blood pressure. It's a nurse who is fully exposed. By the time they see the doctor, it's later. Even when doctors are doing rounds, they come, they do rounds, they go. It is the nurse who is changing the patient, the nurse who is washing the sick patient, the nurse who is injecting the patient. So we are looking at all the health workers, not just doctors. The other thing is also about PPEs. We decided and we agreed as governors that we are going to procure PPEs for those who don't have enough PPEs from across the board, not just as KEMSA, not just from KEMSA. So from the Council of Governors, we are doing everything to ensure that our health workers are working in a good environment. That is why we don't really understand why there is a push to form this crisis of a strike, because as Council of Governors, we agree that doctors and other health workers, especially our nurses, have to work in a very safe environment.
So how is this going to be averted, Dr. Mutua? Because the strike is on Monday.
It's going to be averted by, it's a give and take. The doctors have to realize that this is bigger than just them. This is bigger than just a few doctors are passing away. Any life lost is very serious. A lot of people have died. Nurses have died. Medical doctors have died and everything. This is about Mwananchi getting service on the ground. We are a poor economy. We are struggling. We don't have good systems of dealing with crisis. That has shown this time. But we've handled the COVID pandemic in a very good way in this country. We have tried. The government has really tried. So it's for them to ask themselves, okay, we've gotten this, we've gotten this, we've gotten this, we've gotten this. Let us now continue negotiation as we continue treating our people. But I do agree with the doctors that, yes, they need to have good conditions, but then we also have to ask ourselves at the end of the day, is this the right timing for a strike? When people are dying from a pandemic that came from outside, is this really the right timing for Kenyans to go on strike when they're on the front line in saving lives? Isn't that a little bit selfish? Especially if the other side is willing to give in to so many of your demands. Can't you also be flexible for the sake of Kenyans? Do we have a class of people in this country that feel that they are I don't know, a sense of, what do you call it, entitlement more than others. So I support the doctors. I want my doctors to work in a very good environment.
Yeah.
In Machakos, they work hard for that. In Maendeleo Chap, we want to have healthcare free for everyone in a good environment. But also the doctors should not come out as if they have a sense of entitlement, because other health workers are also in the mix.
Okay. Kagusha, what are your thoughts on this issue? How do we avert this doctor strike? And who should be taking responsibility? Should it be the Ministry of Health? Should it be the governors? They say they're trying to do everything they can.
Yeah, well, I had a meeting 2 days ago with the KMPDU representative of the Central Region, Dr. Gor Goody, who did pay a courtesy call to my office. And we did look at a lot of the issues that the doctors are raising. And definitely, you find that a lot of those issues are quite valid, like the issue of the insurance for the doctors, the issue of treatment for the doctors when they suffer from the COVID-19, particularly when they are looking and taking care of the patients. And they have very valid issues that they are raising. But what I liked about Gorgudi's approach is the fact that she's also reaching out to institutions in the county that can be of help to the doctors in the county. And particularly from the Assembly's perspective, I look at that very positive, because then we would want to be of help to them when it comes even to the issue of budgeting. There are some things that we can be able to handle at the county level, but there are others which must be handled at a higher level. For example, there are some policies that need to be made at the national level to be able to handle and cater for the doctors' issues.
Yeah.
Like there's the issue of the super cover with NHIF that can sort out the insurance problems with doctors, which I think really is there, and we just probably need to have funds allocated to that so that we can have all the doctors taken care of in this cover. So there are efforts from some of the doctors to ensure that there is an amicable solution to this, and that means then we can't really condemn the doctors. What they need is we need to listen to them, we need to support them, and we need to ensure that we try and meet somewhere in between. But at the same time, and that's why I really appreciate the move here in Central, in this region. I want to believe in Nyeri and the surrounding areas, that there is that need for the doctors also to come a little bit down at this point in time, because we're also faced with a very serious pandemic. And you know, we have a very serious challenge now. If doctors step out of the hospitals at this time, we are likely to experience unprecedented challenges with our healthcare system. And so I would think it is important that we, from the devolution side, we listen to them. The Ministry of Health listens to them, and they also calm down, especially at this time. I think there's a time that we all need to kind of understand one another. There's a time that we don't need to chest thump because we are faced with the peculiar challenges. And when you have gone to war and you are in the middle of the war, you may not want to start negotiating for a better package at that particular time when the war is so active. Unless maybe the issues you are raising, and indeed some of them issues they are raising now have to do with how they are handling the war. Because again, of course, you can't also ask someone to go to the war and put them on the front line, then abandon them there and don't provide them with extra bullets when they need them. So at that point, that's why I think we also seriously need to come in and listen to the doctors and see what it is that can be done at this particular moment so that we can all be able to move together. And of course, the bigger solution that will come to the problem of doctors is when we create the Health Service Commission, which is going to take care of all our doctors, and then we can remove this blame game at the county level. You know, the counties are always complaining that a lot of doctors have gone back for masters. They're still paid by the counties, but they're not they're not serving the counties. Once you have a Health Service Commission, then it is able to place doctors. When you have to go for a master's, for example, you can be moved then to Nairobi. You do your master's as you are paid and you work in Nairobi. Then we can bring another doctor to Nyeri, for example. So we have to look at this issue from the broader perspective and also at the current situation now and come up with solutions.
All right. Elachi, and I'll come to you. Is this one of the failures of the government in your view?
Well, in terms of health, you know, health is a devolved function. But before I say that, let me just say this. You know, we come in 2013, and indeed, you salute His Excellency the President. I mean, he believed in teamwork, real good teamwork. he comes in with a new constitution that he has to now unbundle, and it functions, which it functions today. And I think where we just let down the president is where we took advantage of that goodwill and now decided to run our own things and bring him to where we are today. And I think from 2017 now going forward, he realized I don't need, this goodwill is not goodwill to support. It's goodwill because everyone is selfish. We are just doing our things. I take over. It's when we have seen many things now coming out clearly, and even the president being able to look, this is Kenya, this is how we are moving. For us as women of this country, I think one thing we fought in the BBI is to have a commission to deal with this matter. And I think even when I was in the Senate, we kept on saying we must return back the human resource to the national government. And we really fought. I know the senators who are elected did not, they will keep on saying no, but we felt at that time things are not right. Reasons were, you want to transfer just a doctor from Nairobi to another place. Yet, you know, maybe we have only 6 neurosurgeons or 10. Yeah. We have, and therefore, if this doctor is supposed to go and help, for example, Malindi or Mombasa, the process is just too long. And I am still saying, even here today, Trevor, we need the Health Commission. That proposal from the Women Embrace was a proposal to heal all this. Because today, if we move forward without that, then it means we shall always have this challenge. Yeah. But for now, we also need to look at the country, and I want to plead with the doctors that remember also, the salaries you receive come from Kenyans who pay taxes so that you're able to get that salary. If it's COVID, everyone is affected. Businesses where we used to get that revenue is affected. I just want to plead with them. Look at a win-win. I support them in terms of you must give them the PAPs. In terms of how to take care of themselves. Now, the issue of insurance, you know, it really, I don't know. I thought when you are employed within that county, then the policy they use has to take care of everyone as staff. So now if we say the county government staffs are not the nurses and the doctors who are taking care of us, then somewhere there, I think we are not doing right. There's a problem. There's a problem. Okay. So for me, the issue of insurance, yes, I agree with Speaker that let us look at the NHIF properly. Okay. And we are hoping it will, it is one of the best, by the way. If run and managed and put into system properly, it can help many civil servants. It is indeed helping those who are using it. So let us look and see how we give not just doctors, but all medics must have an insurance to go to hospital.
Ometangi, very briefly on this, because we have about 3 days to go now for the strike. What then is the way forward?
Trevor, my thoughts and my position as far as how we have treated the issue of healthcare in the country, I can say with a straight face that I don't think we have ever, as a country, prioritized or given the slot in order of priority that we should have given health. Not both at national government and even at county government level. We've not. And we have to be honest about what we've done. We've prioritized other things beyond, and Trevor, let's put it this clear. If you examine any country that has succeeded internationally, look at the UK. If you go to the UK, the first benefit that you find even immigrants will be talking about all over is the kind of healthcare they'll find, they'll receive. I mean, it's free wherever you go. I mean, take your child, take your relative. I mean, healthcare is available at its best. Look at the biggest debate that the Obama administration had in the US. It is the Obamacare debate on health. Remember the presidency of Bill Clinton. It was pegged on how he dealt with healthcare in his country. Look at the success stories of countries like Singapore. I mean, the first thing that Lee Kuan Yew did was to ensure that healthcare for his people was top priority. Now, this is not what we've done. What do you have in Kenya? And we must be straight-faced about this. When you come up with a proposal at national government level, and remember, even if, for example, when we are devolving, because as Elachi said, it's true, health is a devolved function. That does not obliterate the fact that when national government disburses, even if it is 35% of the resources, they are still left with 65% of those resources. Yes. So what do they do with the 65% of the resources? I mean, that's a big question. So why do they prioritize? And of course, there has been, you can laud some of the big good thoughts that have started, but even how they executed finally. Look at what we call the MES, you know, the universal healthcare, when the president did a good thing to first ensure that we have equipment that is necessary for every hospital around the country. But look at how it was rolled out finally. Look at what happened. I was part of the team that went around the whole country myself, looking at how this equipment have been put to use. Yeah. And so even as governors come out to complain, I went to hospitals where you find that there is dire need for an X-ray machine. And it is there. It was brought. But it is put somewhere in a store. It has gathered dust. And the complaint of that governor whom you'll be talking to is because there is no electricity in that particular place. So what are you talking about? If you look at, for example, the complaints by doctors right now, and I'm talking about national government level, about the insurance of doctors, this should not be a debate. Why are we making this a debate? Resources are available. To do so many other things. When we were struck by COVID, a decision was made that we are going to freeze all foreign travel for the executive and parliament, and resources were found to deal with corona as a pandemic then. Why not make this a national priority continuously, such that when you have resources, you say this is the amount that is allocated to healthcare. Trevor, if you look at the order of priority, when we pass the budget, the biggest chunk of the budget goes to security. If you look at how much the Minister of Interior receives, it's the most humongous amount. Look at how much is allocated to departments of government other than health. Why not make health the top priority? If you go to county government level, I hear Governor Mutu, I agree with some of the things that he's saying, but governors are not exempt, and neither are they clean, neither have they done the right thing. I mean, you go to a certain county, I've been there, I've been a member of the Public Accounts Committee, now I'm the chairman of infrastructure, and I've gone around. And you go to a county where there is absolute dire need for at least an acceptable human level of healthcare. You find that the top priority of that county government is to build an 18-story 600-room county headquarters where there's nobody who is sitting in there. And it is supposed to appease CECs and whatever to look magnificent and big. The top priority is to go and build county offices, sub-county offices and ward offices for MCAs to please them so that they don't impeach the governor. But I tell you, if you look at what is done for healthcare, it is zero. It is zero. I mean, I've been to some of those marginalized areas, Trevor, and you go and find people who are infested by flies. They have dysentery, they are suffering. And when you go back to where you're meeting the governor, my friend, you're going to walk into an unbelievable, humongous pillar of construction that should have been somewhere in the CBD in Nairobi, not in a remote county. And so what I'm saying is that you see, every time when you have something about healthcare, that is where the easiest avenue for looting happens. And that's why you've had all these scandals. If you look at the most big scandals around about corruption and looting, they have been around matters of healthcare. So, and I believe what we need to do, and I wish this debate was occurring even before we talked about the constitutional amendments that we have there. What would have been and should be top priority, even when we talk about, for example, the BBA process, is how we are going to make it mandatory. That the healthcare and welfare, for example, of doctors is taken care of. How do you expect, for goodness sake, doctors who are taking care of the lives of people, they're losing their own lives themselves in front of their own families. And then you're talking about paying these guys meager wages. You find that you go to county government levels, you find that there are cases that are existing right now. The governor is taking healthcare representatives arbitration forums and to court, arguing about how they cannot be paid their allowances and overtime, yet they have been working. Okay. So I'm saying, whatever discussion we want to have, Trevor, we can have discussion about roads, we can have a discussion about building tall buildings, we can have a discussion about railways and so on, but we cannot have a discussion about the lives and livelihoods of Kenyans. Okay. When it comes to healthcare, that must be top priority. And for any government to succeed, county or national, this must be the way we look at things. Okay. Yes.
Governor Mutua, I'll give you the final say on this. The doctors gave 21 days, now we are down to 3. Yes, yes. Will we avert this strike?
No, I believe we'll avert it because, as I said earlier on, the Council of Governors has come out clearly and said, yes, we've agreed to basically everything that the doctors are asking. And as Senator Matangi says, a lot also remains with the national government in order to keep their promises and get things moving. And in terms of the state of healthcare, I think Wamatangi is a bit harsh because if you look at all the county governments, all of them have over 30 and even 35% of their budget is allocated to healthcare, which is actually the largest chunk in all the county governments in terms of healthcare. Yes, others have not come up and done as well as others, but I believe, for example, the reason I got re-elected in a very, very tough election is because of what I've done in healthcare in Machakos, where we've got the Machakos Cancer Center, we've got free treatment to our people, renovated our healthcare centers, ensure there's water, electricity, and all that. So I think it's not everywhere that it's bleak. A lot of changes have occurred as a result of governors working and the Council of Governors pushing for this. All I'm requesting is this. We understand the plight of medical workers. We understand the plight of our health workers, from nurses, our pharmacists, our medical doctors. We're in a pandemic. Things are tough. Yes, there are things we should have done better. Others have done better than others. Let us keep on pushing. And I encourage the doctors, keep on pushing. Let us get these things done. But I would urge them to put off the strike, because if at least we've met over 90% of the requests that they're asking for, and they're legit requests, by the way. These requests they're asking for are not illegitimate. They are actually legit requests because there are things that should be done for them. You need to get your rights. I was the first person in this country to say that we need to give more allowances to our frontline workers or health workers. I was vilified. You know, I got letters from everybody. Where will we pay them from? etc, etc. I said, if we can afford to do some things, we can afford to pay our health workers. And that became basically the principle and the policy. And I'm pushing for that. Let's pay our health workers our allowances. Let's provide PPEs. Let's give them a good work environment. Let's provide them advanced NHIF healthcare for those ones who haven't. Some of us have already done that. But even as we do this, let them also look at the goodwill of what is being done and think not only of themselves, but of their mothers, their fathers, their sisters, who may be in hospital dying from COVID or other diseases.
So we'll be reaching out to the doctors today.
The elite are comfortable. They'll go to private hospitals. The elite will be okay. But the villager down there will be suffering. And you feel like you're punishing the elite, but you're not punishing the elite. You're actually punishing the wretched of this country.
After the governor's meeting, will you be reaching out to the doctors, Mutua? Very briefly.
Yes, we're reaching out to them. We've talked to them. We've got our committee. We've held meetings. As I indicated, this is a matter of priority to county governors. That is why at 2 o'clock today we are holding another meeting, an emergency council of governors meeting, to find ways of further discussing with the doctors. But even as we meet and talk to them, we are asking them also to open their eyes and their ears and to also come with an open heart, not just for the governors, but also for the people of Kenya who need the services of health workers.
Gentlemen, I have to leave it there, ladies and gentlemen. Honorable Kimani Wamatangi, Senator Kiambu, Honorable Beatrice Elachi, former Speaker, Nairobi County Assembly, Honorable John Kagushia, Speaker, Nyeri County Assembly, and Honorable Dr. Alfred Mutua, Machakos Governor. Thank you so much for speaking to us this morning. I'm sure we'll have again another discussion on this issue around State of the Nation. But for now, we're taking a quick break. When we come back, cooking tips with Willis.